Hey guys, big news out of Minnesota. If you are on Medicare, you're going to want to watch this video in its entirety because UCare Medicare Advantage plans are going away in 2026. So you're going to want to stay tuned because I'm going to talk about what that means if you live in Minnesota and you are on a UCare Medicare Advantage. If you're new to my channel, my name is Jamie from meetjamie.com. I'm a licensed insurance agent. I help people understand how the Medicare program works, as well as connect them with the coverage that fits their needs. This is big news. This is just come out in the last 24 hours that UCare Medicare Advantage plans are ending in 2026. This will actually affect 158,000 members roughly. So if you are one of these people, this is a video that I think you're going to find helpful to know next steps of what you need to do in 2026. So let's just jump into it and talk about what we're going to cover today. So if you are on a UCare Medicare Advantage plan, we're going to talk about your options. What can you do if you are getting this notice even this month about your plan ending? Next, we're going to talk about the mistakes that you need to avoid if you are in this situation. And there are several of them, so you're going to want to stay tuned. We're going to talk about the important next steps that you can take if this is something that is affecting you. You're going to want to stay tuned because this could literally save you thousands of dollars. So let's get into it. So why is this happening? How did we get here? How did we get to the point where we see these mass exodus of Medicare Advantage plans? Someone just asked me this today in my office. There are several different reasons, and you can't pinpoint it to one thing. A lot of people on YouTube, especially in the comments, they like to say it is because of this one thing. Maybe they want to blame a politician. The fact of the matter is, there has been rising costs in the health insurance space overall, which has caused a financial strain on these health insurance companies. And we are seeing large amounts of layoffs as well as Medicaid cuts. So there's a lot of factors. The important thing to remember is it doesn't really matter how we got here. What matters is where do we go from here? And that's what I want to explain in today's video. And the reason that this is so important is out of these 150 plus thousand people on Medicare, if you're one of these, if you don't take the time to review what's called your annual notice of change and look this over and prepare for the open enrollment, which starts in just over a month, you're going to be in for a shock potentially come January when you find out that your Medicare plan is no longer even in place. I have this newspaper ad from last year, which was the front page, talking about this happening last fall. And last fall this happened, and there was 59,000 people affected. This is almost 3 times the amount of people. I got calls after open enrollment was done because people didn't read the mail. They didn't open up this letter that they got telling them that their plan was ending, and they were left scrambling. And so I'm making this video today to hopefully help those of you who watch YouTube, who pay attention to the trends in Medicare, be ready come October 15th so you can make the change that's important to you for next year. Again, why this matters: 158,000 Minnesotans now must switch their plan coverage. The reason this is important is that your doctor or your hospital may not stay covered. There's nothing worse than going to the doctor and finding out they don't take your plan anymore. And you don't want to delay because it could mean a loss in coverage. There's a limited time that you have to make this change. And so it's something you're going to want to be aware of. So let's talk about the important dates when it comes to these changes. So the reason that these health insurance companies have to send you that annual notice of change at this time of year is because the annual enrollment period runs from October 15th through December 7th. This is your opportunity to make the change, to make sure that you have the right plan for you in 2026. This is what I mean about a window of opportunity. And the problem is that it unfortunately falls right around when people start to think about the holidays. So you have Halloween, which isn't as big of a holiday as Thanksgiving, and then into Christmas. And I think this causes a lot of people to not pay attention. And less than 30% of people on Medicare review their benefits during the open enrollment or annual enrollment period. Again, if you live in Minnesota, if you have a UCare Medicare Advantage plan, this is not going to be a year that you're going to want to sleep on this. There are deadlines that are in place, and if you miss it, nobody can help you, even an agent. So what are your options? Number one, your option is you can switch to another Medicare Advantage plan, right? So there are people who naturally make changes during the open enrollment because they want a different type of plan. So I don't want to scare people. I just want to make people aware that this is a change that is being basically forced on people. Some years people change plans just because they want to. They find a plan they like better. So they switch from one Medicare Advantage plan to the other. This is a situation where if you're losing coverage, you really have to do something during this period. So if you do this, you're going to want to make sure you check the network. So you're going to want to make sure your doctors and specialists and hospitals and clinics are in network. You're going to want to understand the restrictions of this new Medicare Advantage plan. I talk to so many people who have friends and family who don't really even know what plan they have or how it works. So you're going to have to do some due diligence. This is where it can be very advantageous to work with a broker or an agent because their services are free to you and they can help guide you through this. So hopefully you have an agent. Hopefully you have a broker who can help you. If not, you can always reach out to me through my website, meetjamie.com. So during that window, October 15th through December 7th, you're going to have the opportunity to look for new coverage, to find a new plan, to get that in place, and it will start January 1st, and so you will not have a gap in coverage. The other option that you have is to go to Medicare and Medigap. So if you've seen some of my other videos, you know that there are two paths to Medicare, only two. Either original Medicare with a supplement and a drug plan, or Medicare Advantage plan. So the thing about losing your plan is that you now have an opportunity to go to a Medigap plan. And bear in mind that it does come with potentially higher premiums, but it also gives you broader networks and it has fewer limitations than an Advantage plan. If you look at the Medicare and You handbook, which I have in the background here, you might have one in your house. On page 10 of that book, it'll actually tell you that with a Medicare supplement plan, the litmus test for the network, so to speak, is does the provider take Medicare? So the book actually says you can see any provider in the United States that accepts Medicare. So you have this option now, this window of opportunity. And if you lose your plan, you actually get guaranteed issue on this supplement. So it's something that you're going to want to pay attention to. It's going to be why you want to keep that letter, because it's going to have the proof that you lost the letter. That's going to be what you can actually present to the insurance company to say, hey, I lost this coverage and I can now qualify for a supplement potentially without medical underwriting. So again, just to recap, if you are one of these people who have lost this Medicare Advantage plan, you have two options. Option one, you choose another Medicare Advantage plan during the open enrollment, or option two, you get to choose a Medigap plan during the open enrollment. And so It's inconvenient. That's the big thing. A lot of us just don't like the inconvenience of change, myself included. I put myself in that bucket. I don't like change. I don't like the inconvenience. But it's something that's going to happen, unfortunately, whether people wanted it to or not. And so what I want to do in this video is just give you the tools that you need to make sure that you have the right coverage in 2026. All right, next. Let's talk about the mistakes that people make. So these are some of the mistakes I saw last year when this happened. Human nature, again, is such that people wait to the last minute. You don't want to wait to the last minute. Insurance companies, agents, brokers, they're going to get inundated because of this change. So don't wait to the last minute. Second, I see this happen all the time. Do not choose a plan based on its perks. So there are agents out there, there are brokers out there who like to talk about the additional benefits. That's all great. Some of them are good. They're an added bonus, but it would be a huge mistake to choose something just for the perk and not check if your doctors are in network, to not check how your prescriptions are covered, to not check if I go to the hospital, what hospital can I go to? So don't choose a plan just based on a perceived perk that it is offering. Remember, this is major medical insurance. You want to have coverage in place should the worst happen. And trust me when I tell you this, after thousands of people watching my videos and me talking to hundreds of them personally, the worst can happen. And you don't want to be stuck in the wrong plan if the worst happens. Next, this is what you can do. So you can compare not just the premium, but the total cost. So don't just look at the monthly premium. Look at the out-of-pocket costs, the deductibles, the co-insurance, the co-payment. In October, you can start to look at the Medicare Plan Finder on Medicare.gov, and you can start to see the changes. So if you go to Medicare.gov now and look at the Plan Finder compared to next month, so September, October, it's going to look different, right? They're going to have to update this for the changes. Don't forget, Medicare Advantage plans and Part D drug plans vary by the county that you live in. So it's specific to your county. So you can do some of this research on your own. As an agent, I love talking to people who have already done a big chunk of educating themselves. It makes, quite honestly, it makes my job easier. And so I love when I talk to people who have done a bunch of research already. But that leads to the third thing, which is you can talk with an independent agent. You can reach out to someone like me. You can look for someone in your local community. You can ask a friend or family member, hey, I need help. When changes like this happen, and again, we're just talking about one company in one state. We're not talking about the whole country yet. There are over 50 million people on Medicare, right? There are a lot of people that are potentially going to need help. Just with this plan change in Minnesota, almost 25% of people on Medicare are going to be affected. There are agents that are willing and ready to help you. So reach out to them, have a conversation with them, because at the end of the day, even if this news blindsides you, whether you saw it in the media or you got the letter, you have options, but you have to take action. Don't ignore mail from your insurance company that gives you your Medicare coverage. You can reach out to me at any time. My toll-free number is there on the screen. You can go to my website. You can book a call there. This is something that you're going to want to stay ahead of. I don't necessarily like having to do videos like this because I know how disruptive it is to your life if you're one of these people that are affected by this. However, just count your blessings for what you have in your life. Be thankful that there are people out there who can help navigate this with you and can help you make sure that you have the coverage in 2026. If you found this video helpful, please consider subscribing to the channel, hitting the like button. Let me know what you think about these changes in the comments. And again, if you have any questions, reach out to me through my website, which is just meetjamie.com. Stay tuned. I'll have more breaking news for you in the Medicare world in the coming weeks, I'm sure. Have a great day.